Hi, I'm Dr. Matthew Walker at OrthoVirginia. So we're going to spend a minute talking about rotator cuff and the problems that you can have with the rotator cuff. First of all, what is the rotator cuff? The rotator cuff is made of four muscles that surround the shoulder: the supraspinatus, which is on the top, the subscapularis, which is in the front, the infraspinatus, and the teres minor, which are in the back. They have three important jobs. They rotate the arm, that's where they get their name from. They help your deltoid raise the arm above you, and they help keep the ball centered on the socket. Two main pathologies can happen with the rotator cuff. One of those are tendonitis or bursitis, or what we call impingement syndrome. Impingement syndrome or tendonitis is exactly as it sounds. The tendons become inflamed, swollen, and irritated. We usually treat that with non-operative things like anti-inflammatories, injections, and physical therapy. The second major problem with the rotator cuff involves rotator cuff tears. Rotator cuff tears come in all shapes and sizes. You can have partial tears. Often those don't need surgery. We can treat those the same way as tendonitis with injections and therapy. Full thickness tears come in all sizes and shapes as well. Small full thickness tears we can repair. Medium-sized ones we can repair pretty well. If the tear gets bigger, we might cross the threshold where those tears are unfixable, and we have to treat those with different procedures. Some of those procedures are muscle or tendon transfers. One of the tendon transfers we do is the lower trapezius transfer to substitute for the top back portion of the tendon, or the latissimus transfer, which can substitute for the subscapularis tendon. Tendon transfers are good for middle-aged patients. If the tear is very large and unfixable, and you have arthritis in the shoulder, or maybe you're past the middle-age group, we talk about replacements, specifically reverse shoulder replacements for rotator cuff tears that are unfixable, causing pain and poor motion. When do you go see your doctor? Rotator cuff pain is pain in the side of the arm. It hurts with elevation. It hurts at nighttime. You might have weakness if you try to reach across the table and pour a pot of coffee. The arm may give out. You might not have the strength to hold it. So if you have pain in the side of the arm that's lasting more than a couple weeks, pain with overactivity, nighttime pain, or weakness in the shoulder, see your shoulder surgeon at OrthoVirginia.